Hi, this is Beth Perry from Wellness 360, and I'm bringing you our Wellness Talk on Friday night on our Facebook Live feed. I'm here with Jay Verna. Jay, say hello to everyone.
Hey, everybody. Good to see you again.
So, as you know, Jay and I come together on Friday nights to talk about everything wellness. We want to provide you with the most education that we can so that you can make better choices to be healthy and live a healthier, happier lifestyle. So today we have some really exciting news. We have Dr. Matt Driscoll with us. Hello.
Hi, guys.
I'm going to throw this
How's everybody doing?
Yeah, I'm going to throw this over to Jay and let him give you a nice introduction.
No pressure there, man.
Yeah, no pressure, Jay. I'm Matt, guys. That's all you need to know.
Yeah. So as Beth said, we have Dr. Matt Driscoll of Driscoll Chiropractic over on Empire Boulevard. I actually have had the pleasure of meeting with Matt several times over the last couple of years. We're going to get into some really interesting discussions today, certainly on a topic that we're both keen on. But I think I'll just start out by turning it over to you, Matt, and kind of giving you or give us a little bit of a background and tell us a little bit about yourself.
Well, thanks for the invite, guys. I really appreciate it. For your listeners, I have my own podcast, a little plug here, Rock Spotlight is called. So this will be nice today for the tables to turn and I guess be interviewed. If there's one thing that I learned being a host on a podcast, it's that you have to actively listen. And that was very challenging for me because I was always interrupting people. And you guys are doing great, by the way. I know we just started, but being here, being interviewed, will be nice to talk for a chance.
Absolutely.
I'm born and raised in Buffalo. Went to a chiropractor growing up with my family. My dad had a bad back, so he kind of started bringing the whole family. And health and wellness has always been really a staple to me and my upbringing because of my dad bringing us to the chiropractor, but more my mom. She always cooked healthy. She always strived to be a good example for us. And I was in athletics. I played 3 sports growing up. And then I went on to play college football at St. John Fisher. And the chiropractor helped keep me healthy and on the field. So when everyone asks, what do you want to be when you grow up? I always looked at my chiropractor back at home and he was always smiling, using his hands to heal people and help people. And he worked like 3 days a week. And I'm just like, I want to do that. That sounds pretty cool. So I kept my head down and got through school and went pre-med. And then I went to chiropractic college in Seneca Falls, New York Chiropractic College. And then there is where you learn a ton, right? Going through school, but you get your feet wet and you figure out what you don't want to do and what you do want to do. So I shadowed a ton of doctors. I wasn't confident enough in my business skill set to open up my own practice. So I shadowed probably 20 doctors locally when I figured out, okay, I'm going to stay in Rochester. And shout out to my wife, Kirsten, who she won me over. So she's from Rochester. That's why I'm living here now. We also got 2 little girls at home, Adelaide and Violet, who are 3 and 1. So life is hectic, but getting back to finishing up school. So I shadowed a ton of docs, figured out, half these guys, I'm just like, I can't do this every day. The other half, I'm like, okay, this is cool. I like this, I like that. There was this one practice in Pittsburgh that treated a lot of athletes and I just fell in love with it. And I pretty much told the doctor there, listen, you got to hire me. So I forced him to hire me and bring me on. Great decision. I learned a ton. I stayed there for 5 years and then I just had an itch, probably like year 4, start of year 5, to just do my own thing. And the rest is kind of history. I've been doing this Driscoll Chiropractic for the last 2 years. It was the best move for myself and my family. And I'm just really excited to get this message out, to get people out of pain, to give people alternative measures to treat their pain and to live the life that they want to live. So that's kind of where I'm at.
That is absolutely amazing. So I just want to give Dr. Driscoll a pat on the back. I have been listening to his podcast all morning long, and they are absolutely amazing, and they're fun, and they're educational, and I really enjoyed it. And I have to say, you touched on something just a minute ago. I love the background story, but about watching your mom and your mom making these amazing decisions growing up. And as a mom, And as a mindfulness coach, I just want all of you women out there and dads to know that your kids are watching. You know what I mean? Your kids are watching. You don't have to be perfect by any way, shape, or form, but just making small changes, bringing your kids into the kitchen, letting them pick a fun veggie, going to the farmer's market, picking a vegetable that is something new for all of you and discovering new ways to cook it. There's so many things that we can do to be good examples to our children. So I just wanted to throw that out there because it made me smile when you said that.
100%. I actually had my mom on the podcast, and that was a very special episode. I don't remember the number, but I think it was around Christmas time last year. And I wanted to bring her on because, yeah, like she was my inspiration to get into this field and to live a healthy lifestyle, not only for me, but for my 2 young daughters and my wife. So we can talk more about that, but.
Yeah, that's awesome. So let's talk a little bit about your professional philosophy. So what would you consider to be your professional philosophy?
Checking these questions out last night, and that was a good one. That was probably my favorite one right there. And I'm like, how am I going to answer this? Much, right? The years. And I think I found, and this was some contention for me at the old practice too, which is why I kind of branched out and did my own thing, because I love holistic health. I love talking. First of all, movement is my bread and butter. I'm more of a movement specialist, and that's what I do probably 75% of the time. And then I try to fill in the gaps with nutrition, with sleep, and with breathing. And I think fitness and nutrition, people go right to that with their health. It's like, how can I improve my health? Let's eat better. Let's move more. Let's figure out this movement piece. And yes, that's critical. But I think the other two, sleep and breathing, aren't talked about enough. They're kind of pushed under the rug. So I'm trying to figure out a way to get that into my practice more. And with the pandemic, I've been doing a little bit more remote coaching, but also I spend time with patients too. So an hour-long visit 1 evaluation, I mean, we're going to talk about all that stuff. And then each visit, I kind of pepper in new things depending on the patient and what's going on. So I think my philosophy is more of a holistic healthcare philosophy, and it's the 4 pillars of health. It's movement, nutrition, sleep, and breathing.
Yeah, I think that sounds awesome. And we've had a chance to talk a little bit, Matt, several different times. And I think, and even with Beth, a lot of what we've done so far on these talks, we kind of align on that same philosophy. I have almost a quarter century of experience in coaching in the strength and conditioning, fitness and wellness space. And one of the things I've learned is that those foundations of sleep and utilizing different types of breathing can be absolute game changers and absolutely affect fitness and nutritional decisions too. So I'm definitely on board with that. I think sometimes I think the movement that we're seeing is shifting more towards a proactive, preventative way of treatment. So in other words, educating people to be more proactive with their health and giving them some of these tools. I focus a lot on our YouTube channel with things like that. And let's face it, it's not the most exciting stuff. It's not the sexiest stuff out there, but it's absolutely critical. And anybody that really embraces this type of thing will find that it's absolutely a game changer.
Absolutely. I'm all about, well, I think there's no better time than now to get in the health and wellness space. I really think that the next 5 to 10 years, it's just going to explode. And I'm just so excited for that. So if there's any listeners right now thinking of going in this field, I think it's a great time to go in. Yes, it's scary starting a new business venture. It's very scary, but if you're getting that itch, I say, go for it. I love teaching my patients, you guys, listeners on my podcast, simple, inexpensive, effective treatments. I love to continually learn, and I'm always growing. I'm always adding new tools to the toolbox. And, I don't want to say I get to play around with it in the practice, but I do. I test it on myself first and my family members. And then I dive in and I try to get people better. And if I can't, then let's send you somewhere else and get you better.
Yeah.
I couldn't agree with you more there, especially in the physical therapy realm, is, none of us wear the God hat. We all work together to help someone. I refer out to chiropractic all the time. So it's finding that community of support to help you to grow. It's not just about chiropractic. It's not just, and I love your business because when I was researching through it, you do a little bit of everything. You do a little bit of all aspects. And I hope with Wellness 360, that is our thing too. That's why we started this podcast with Jay, is we want to educate. We want to work on mindfulness when people get diagnosed with diseases. I mean, there's a lot of stress involved with that. And as you know, sleep being affected and stress, happening. And then you got the weight gain and the disease progression. And there's just so much for someone to carry through life. So I love that all of us together as healthcare professionals are working to pool different areas of expertise. And it's now you're not going just for physical therapy. You're not going just for chiropractic. You're learning about breath work and eating and how's your sleep and how, we're getting to the source of the problem instead of just throwing that Band-Aid across the problem.
That's where the art of being a practitioner comes in too, and as a professional, it's like knowing when to stay in your lane too. So I don't talk about all this stuff with every patient because some patients don't want to hear about breathing. They think their breathing is perfect. And it's like, okay, like we're not going to go there. We're going to focus. They're resonating with this movement piece, with this foundation training piece. So we're going to really spend quality time doing that because it's going to hit home. It's going to create change, So I've struggled with that because I want to do all the things, right? I want to do all the things each and every day. And it's like, you just can't, I had my philosophy was like 7 pillars at first. And my wife's like, what the heck is this? Like way too much going on. Cut it back a little bit. So, and tiny, but it's fun for me because it keeps me energized and going.
Yeah. Most of my education was more for self-care, and it ended up developing into more than that. I'm a lifelong learner too. My certificates are like this long because I'm like, oh, I want to learn about that. Oh, I want to do that. So I'm not just going to go and learn about it. I'm going to go get certified in it because for some reason that piece of paper to me makes a world of difference. But yeah, I'm the same way. I think that it's really cool to be able to have that background and that unique, which after reading your bio and listening to some of your podcast, you have a lot of the same philosophies that Jay and I have when it comes to wellness and life. So let's talk a little bit about foundation training. So Jay's like, have you heard of foundation training? I said, yeah, a little bit, but I'm going to dive in more. So I spent a lot of the morning looking at your foundations training stuff. So talk a little bit more about that.
Yeah, so foundation training, I was introduced to, let's see here, I think my first year into practice, so 2013. So as I was getting close to graduating, I realized that physical therapy is really important to me. Movement's really important to me. I don't want to just be a high volume clinic where I just adjust 100 people a day. I agree with the adjustment. Obviously, I do that pretty much in every patient. It's a powerful tool, but it's not the only tool. So I realized that my business practice model was going to be, I'm going to spend more time with patients. So I got to find these active home care exercises that are going to work, but I got to find the right stuff. So I really went on a quest to find that. And, what they teach in school was just very traditional. And I was like, I can do better than this. So I found on Dr. Mercola, I don't know if you guys have heard of him, but Dr. Mercola is a natural health doctor. He publishes an article every day. He's got some good stuff. He's definitely, very far one-sided. I agree with most of his stuff, not all of his stuff, but he had a couple articles on foundation training. And I'm like, who is this guy? Dr. Eric Goodman. And he founded it. He's this surfer out west in California. They got a really cool vibe about him. And I loved his story. His story was all about, he had a bad disc herniation through chiropractic college. So he was just about to graduate, be a chiropractor, and they wanted to do surgery. He couldn't fix his back and he tried everything. And these surgeons are like, we need to operate. He's like, I'm not going to be the doctor, the chiropractor that gets surgery on my back. Like, I need to figure this out. So he started taking a lot of yoga classes and realized that when he hip hinged more and got his spine in a certain position, he felt a lot better. It took pressure off the disc and the nerves. So he just started doing a lot of like chair pose and a lot of poses like that. And it really helped. So fast forward to, 2018, 2019, it's evolved a lot. And he's written 2 or 3 books now. He's got a lot of DVD series. He's got a streaming platform. So this is back in his early work where I kind of adopted it, and I realized that I felt good after doing it. Now, I didn't have a bad back or disc herniation, but a lot of my patients did. So I played around with it in the clinic, and patients liked it. And I could tell that the adjustments were holding longer because they were doing this, because I was giving them results in the clinic. So, and that was only with like a couple like core poses. So then I just started to grow more and more, and I'm like, I don't want to spend the $2,000 to get certified. Like, I'm not ready yet. And then when I practice, I'm like, I need to introduce it. I need to get this certification. So 2018, I started, and you know how it is. I mean, you got a lot of certifications. When you go in person, you just learn so much more. You just immerse yourself for that whole weekend in his content. And it was awesome. I mean, I don't want to say it was life-changing, but I think it is for a lot of my clients, which, I'm humbled to be able to teach them that. So I practice it myself. My wife can attest to that. When I'm like brewing the coffee in the morning, I'm over there doing foundation training for 5 minutes.
That's what we needed. We should have had your wife come on here so she can tell us all about behind the scenes.
I know, right? Next one.
Yeah. So I know Jay's going to have a lot to say about this foundations training because he was really excited, and I know he has that movement class that he teaches. So Jay, I'm going to let you take over from here.
Yeah, in fact, I think that's when I first met Matt, was at one of his courses. I don't know, the last couple of years or so, Matt. I can't remember.
Probably,
I know I went over with the
probably
Amber
2019.
Yeah. So it was a great experience, and I had actually read one of Dr. Goodman's books first, so I was familiar with it. And kind of being a coach for as long as I have, a lot of this stuff kind of made sense to me, and kind of a lot of the stuff that I use myself. You mentioned a little bit about low back pain, and that's something that we see a lot. I know, I'm sure it's the same for you guys, but I know for the population I deal with here at the rec center, I mean, the vast majority of people we see some level of minor discomfort to serious back issues. We see a lot. It's probably one of the most common things. And you kind of already spoke to it a little bit, but maybe talk a little bit more how you use some of these exercise-based treatments, and even including things like some of the breathing techniques and that sort of thing, to treat some of your patients, and how effective you found it to be.
Yeah, just to simplify foundation training, it's all about decompressing the spine, creating more space in the body, and not just the spine, but most people have low back pain. Most people come to me for low back pain, and this all started with low back pain, but it's really throughout the body. Neck pain, shoulder pain, hip pain. You're just creating more space for your joints, and you're turning on the right muscles and kind of recalibrating your system. So if we cut a line down like our midlines, this is a video, right? So everyone can see this?
Everyone can see it.
Perfect. So like if you cut a line down my midline, my pulley system, which is my body, should be balanced. A lot of us are walking around internally rotated at the shoulder joint, and then the head shoots forward. And then gravity is not going anywhere. Gravity is coming down on us continually all day long. So what is that doing downstream? It's just compressing everything. Now we can compensate and get away with that for years, usually, and then it catches up with us. Something's gonna go. A wheel's gonna fall off, your shoulder's gonna go, rotator cuff, disc herniation, your neck, low back. So foundation training is all about anchoring the pelvis, which is our true core, and I'll talk more about this in a little bit, but our epicenter is our pelvis, our pelvic girdle. And then our appendages, our arms and legs, are our levers. So we need to anchor our pelvis to the floor, and then we need to decompress up top. And then we can layer on breathing to make it more effective. Now the breathing piece is definitely the most challenging piece, but it's also the best piece, I think, if you can master it and get it down. Because we're breathing all day, every day. I mean, we can only survive a couple minutes without air. So we might as well make it more effective, especially the biomechanics of breathing. So that's kind of in a nutshell what foundation training is, and how I try to get my patients standing taller, sitting better, hinging better, squatting better, picking something off the ground better, and just moving through life better. So like, I guess I'll give you an example. I don't know if you can really see my whole body here, but I can bring this down a little bit. So if we go back here, so I always start, most people flare their feet out, right? So I always start with the base. So I'll have people touch their big toes and then pop your butt back an inch. So just that, we're in a hip hinge and we're internally rotating the hips. So the biggest flaw that I see with a lot of movement is hips flaring out. And that's from all the sitting that we do. We get lazy, we flare our feet out, okay? So I always start with the foundation, with the feet. We're gonna internally rotate, we're gonna hip hinge, we're gonna wake up our glutes and hamstrings instead of having our spines round and our pelvis is tucked. So most people are standing like this, flared out, hips thrown forward, and the weight's on the balls of the feet. That just crushes everything upstream, especially our lower backs. So if we can just learn to internally rotate, be slightly pigeon-toed with the feet, that'll get the whole chain, knees, hips, back in alignment. And then we start to hip hinge and pull the butt back, your back's gonna feel a lot better. So I'll have patients just get in that position of that pose and they're like, oh, my back pain's gone. Especially SI joint pain. SI is the sacrum and your pelvis is right here. So kind of where those two bones meet. If we're walking like a duck all day, all that jamming. So if we just start to do this, if we just bring the toes in a little bit, it decompresses the back. So, and that's just one example, but I always start with a standing decompression because it shows patients how, it shows them how to unravel these compensation patterns. It shows them how compensated they are on a daily basis. And then it kind of, the light switch goes off for them. It's like, oh man, we got some work to do. I'm like, yeah, we do. So I kind of let them answer that for themselves and then we get to work.
I love that so much. So one of my specialties in PT is sacrums, and I'm all over that information. That's amazing. I'm sitting here and moving my toes together and trying to adjust myself in the seat the whole time you were talking.
I think one of the things that you know, you mentioned, which I think really puts into perspective, is the vast majority of these issues that we see are simple to correct. Not easy. It takes effort, focus, and concentration. But the good news is you don't really need any kind of serious intervention, certainly not surgery. And
No.
I think a lot of people, when they come to us, that's what they're thinking. You make a little tweak like that, you get them to feel differently right off the bat, and then I think they'll buy in, and then they're more likely to, you know, stay with the progression and continue doing it. And I think these exercises are aptly named foundation, because I think that's what's lacking with most of us, the way society is, you know, lack of activity, being in positions over time that just eventually can cause a lot of these aches, pains, and conditions that we see so frequently. So I'm always the one kind of on our staff here that does, again, the stuff that's not always fun or flashy or popular, but it's that foundation vanilla stuff done consistently all the time that's going to allow you to do some of those higher level things. So I think it's awesome. You know, when I kind of dipped my toes into it, you know, I was certainly a believer, and it kind of really fell in step with what I was kind of doing myself.
Mm-hmm.
So next question, we're going to have a little bit of fun here. But I think one of the things that we all talk about is continuing education. There's a lot of different ways to educate ourselves. I'm a huge reader, and I like to read as well. But if you can tell us maybe the last, even 3, 4, or 5 books you might have read, and it could be anything, fiction, nonfiction, fun, guilty pleasure stuff, or certainly professional development.
That's easy, man. I love to read too. So the last 5 that I read have all been nonfiction, self-help. I'm just like, that's totally me. I try the fiction books. I can't do it. What was the one fiction book I read recently? I forget, but Dirty Jeans I read last year. So that was probably, that's number 5. That was probably the best book I read last year. Dirty Jeans is written by Dr. Ben Lynch. And it's just all about like how some people think, oh, I got this bad gene for heart disease. I'm going to die of heart disease. It's like, okay, well, maybe you will down the road, but let's push that way down the road. It doesn't mean you're going to die in 5 years of heart or cancer. You know, we got to turn these genes off. So it's all about epigenetics and how to influence our genes. We can't change our genes, but we can influence them. So our genes is the gun, right? The trigger is lifestyle choices, epigenetics. Epi meaning above our genes. That was a phenomenal resource. And I'm actually thinking about getting genetic tested just to see kind of what genes I really have and how I can influence them better. So I see a functional medicine doctor, and I love seeing her because she spends a lot of time with me, orders the right tests, and gives me a blueprint for me, which is going to be different than So that book is a really good resource for that. And also what I thought from that book, I don't know if you want a summary from all these books, but this book was really, really powerful. It could change a lot of lives. Certain genes, so like MTHFR, maybe some of your listeners have heard of that, that then we can't convert folic acid to folate. But there's pros of having that gene too. Everyone thinks, oh, I got the MTHFR, like I'm going to die from that, or it's terrible, it's bad, bad, bad. Not necessarily. If it's acting dirty, it's bad. If you clean it though, it's going to be good, because it's going to give you drive and motivation to be successful. And it's going to give you certain personality and characteristic traits that are good for you and that you like, especially when you're feeling well and you're like on point. Everyone has those days where everything's just clicking, and that's when your genes are acting clean. But when they're dirty from not sleeping right, from drinking too much, from having poor diet day in and day out, you got to clean your genes. So that was an awesome book. Another one talking about breathing, I'm reading for the second time, is Oxygen Advantage by Patrick McEwen. And that's probably the best breathing book I ever read. I mean, that's a complete game changer. I struggle with a little bit of anxiety, and this is going to sound crazy, but I've been taping my lips when I sleep. So I put they make special tape. Jay, you probably heard of this. Jay, you're crazy like me. You've probably done it too. So they make special lip tape that prevents mouth breathing. So I have had a bad habit of mouth breathing from allergies and asthma growing up that was never addressed. Mouth breathing is terrible for your health. It's not good. You chronically hyperventilate and breathe too much. That gets you up here, out of your belly, into your chest and neck. It vasoconstricts everything, gets you more congested, causes anxiety. So this is only recently that I really dive in and start taping every night. Now I got stories about that. The first night was terrible. I remember ripping it off. I was like, oh my gosh, I think I'm gonna die. Like, you're not gonna die. I'm not telling you to do that. Consult your doctor first. Read this book first. You will wake up though, because you'll get a headache. If you have a deviated septum, you have something structurally wrong with your nose, you would wake up. Your brain would tell your body, contract muscles, wake up. Again, I'm not telling you to tape your lips, but I've been doing that day in and day out for the last month, and I wake up a different person, recharged, refreshed, much more calm. So I get 8 hours to work on my breathing subconsciously, right? So I'm looking at it like that. Now during the day, I'm talking a lot with patients. So yeah, I'm mouth breathing more just because I'm talking, but you'll be amazed. You're going to be looking at people and be like, wow, why is their mouth open? It's because they're a mouth breather. Why are they waking up with a dry mouth or snoring? They're a mouth breather. Just having that very good, and we can change, like tonight. So that's been a really cool read. I'm still working through that for the second time, but he goes over a lot of high altitude training, breath hold exercises that you can work on. So it's really good for performance. I know, Jay, you would like that a lot, because you don't need to go climb a mountain to get that. You can do it right here by holding your breath. What else? I read The Go-Giver. The Go-Giver was all about, selfishly, we're all selfish. We all want to receive in this world, in this life. So, but if you flip the tables a little bit, if you flip the script and you give more, you get more. So that was pretty cool. I actually got this from the book. I don't know if you can see it. So I printed this out. You probably can't read it, but I'll read it to you guys. So this was like the 5 laws of stratospheric success that I got from the book. So the law of value: your true worth is determined by how much more you give in value than you take in payment. The law of compensation: your income is determined by how many people you serve and how well you serve them. The law of influence: your influence is determined by how abundantly you place other people's interests first. The law of authenticity: the most valuable gift you have to offer is yourself. And then the law of receptivity: the key to effective giving is to stay open to receiving. So I read that every morning. Especially before treating 8 to 10 patients a day, I'm just like, I got to get my mind right. So that really helps me, just to put them and their needs first. And then I just finished The Obstacle is the Way, which was by Ryan Holiday. That was a good one. Just all about we're never going to be done with obstacles. Sometimes we think like, oh, that was the hardest obstacle of my life. Like I'm done. I'm moving forward. There's never going to be another obstacle. Every day we have obstacles, right? Some smaller than others. But how can we find and see opportunity in those obstacles? How can we turn the tables there and flip that obstacle upside down and be like, wow, like look at what this is really presenting me, or look at what this is closing this door and opening that door. So that was a really good read too. Maybe Harry Potter is going to be next.
We'll do it.
I need it. My wife's always telling me, she's like, you need to read some fiction. That's all you read is nonfiction.
I'm the same way though. I was looking through my list when I was reading through these questions, and I went to my Kindle and I like just went through, and I was 50-50. I was 50-50 on mine, but I just read the Go Giver book also, and it was amazing.
Oh, you did?
Yeah.
Isn't it good?
And it
was a quick read too.
Quite a few. It was a quick read. It was an easy read. It was inspirational, and he had a couple different in the series that I found. I actually went to a marketing group. So I was in the marketing group and they had discussed that book. So I went home and read it. And Jay and I do the same thing. Jay, I think we need to read Dirty Jeans. I think that'll be our next.
Well, yeah, I've got my list here that's going to keep me busy probably for the next 6 weeks.
Sorry, guys. Sorry, not sorry.
Yeah, I love it. I was just having that discussion with one of my friends who's a nutritionist over the weekend about the genes, and so many people just automatically assume, well, my mom had diabetes and my grandmother had diabetes, so I know I'm going to have diabetes. And it's really sad to just accept that as your fate, when it takes, understanding that you can turn on and off those genes. Even if the people that I work with, even if you've already been diagnosed with something, you can be the healthiest you with your diagnosis. You don't have to accept that diagnosis as part of you. You can live the healthiest lifestyle that you can. I've seen people that have been diagnosed with Parkinson's for over 20 plus years, and they are as healthy as can be. And I wouldn't even know they had Parkinson's had they not told me.
And as patients, I mean, we need to get informed. Like there's no better time than now with all this information out there. So, you need to take your health into your control, and you're going to be able to make the most change. I mean, your doctors can only do so much, and there's better doctors than some doctors out there. You can tell, usually visit one if this person really cares about you, but at the end of the day, it's like, you got to work together, but really dive in yourself and get educated and try to make the changes.
I could not agree more. And that's, again, why Jay and I started doing this, because we wanted to figure out new ways to reach out to people and give them just little tiny tidbits, just little things. And we never say, oh, well, we did a talk on sleep. Oh, well, you need to start and set all of these goals. It's like, what? Do one thing. Mm-hmm. Set your alarm for 6:30 every morning. Wake up at the same time every morning. Maybe start there. Maybe stop with the TV an hour before you go to bed. Just these little tiny lifestyle changes that make such a big difference in their world.
Yeah, I agree with all that. I think one thing that's helped me and that I would encourage everybody to do is just truly be open-minded. There's a lot of stuff out there. There's a lot of good information, a lot of good professionals in the field. I'm talking to two of them right here. And don't be afraid to self-experiment. Certainly consult with your doctor if you're looking to make any kind of serious life changes. But one of the things, if I've gotten good at anything, is just trying what. And Beth and I have talked about this. We're literally building our own owner's manual. No one knows us better than ourselves. Experiment. What makes you feel good? What makes you feel happy? What gives you value? What makes makes you feel healthy? So. Being open-minded, whether you're a healthcare professional or just someone that's, anywhere in the wellness space, I think is really, really important.
And more is never better, right? And I have this conversation every day with patients, especially with overtraining. I talk a lot about overtraining. I see a lot of that because I treat a lot of athletes and active population, but also supplements too, right? I mean, we spend all this money on these supplements, and it's just like, we're just pumping it into our body, but we don't even realize how we're feeling. It's like, do you really need that? Some days you might. So in Dirty Jeans, he talks about that too, the pulse method. So pulse it, take it a day, see how you feel. How do you feel an hour later after taking that multivitamin? Wow, I feel energized. Okay, you were deficient in something, or vitamin D or a B complex. You get anxiety the next day because you took 2 the day before and then you took 2 that morning. It's just too much. It's overloading your system, and it's letting you know that. But we're not aware and mindful enough. I think especially when it comes to overtraining in nutrition and with supplements. So I would just encourage listeners to do that. Really tap into that intuition. And like Jay said, I mean, we're in our driver's seat. You know, everyone's different.
Yeah, I teach that in my mindfulness class, trying to get people just to introduce themselves to their self again, just to become more aware. And I've actually had people in my mindfulness class say, why do I have to be aware of how I'm feeling? Like, they cannot understand the concept of, how are you feeling today? Maybe if you're feeling low, maybe you don't go for the jog, maybe you stay home and do some yoga. Like, just listen to your body. They are coming around. They continue to come to my class, so I do have faith that they are coming around. But yeah, just awareness. I hope that in my practice, I just want to build awareness in people. That's really plain and simple. Just become aware of your own cues, of your own triggers, of your own, the way you're feeling. I just think that is like the #1 most important thing that you can do in your own life. Not to become hyper aware, but just to at least once a day check in with yourself. Hey, how are you feeling today? Hey, you ate a little gross yesterday. How are you feeling today? Maybe you had 1 too many drinks. How are you feeling today? You know, maybe we'll make a better choice next time. So, all right. So now for some more fun, we want to know 3 fun facts about Dr. Matt.
3 fun facts. All right. I feel like I'm a boring person. I just love my science and training
and, your books?
and my books. Yeah. I got some fun facts though. So my mom's a music teacher and my dad's a big time jock. So sports is a big part of my life, but also music was. I wish it still is, but I played the saxophone growing up. I played the alto saxophone all the way through high school. I was in marching band, jazz band, all that stuff. And I'm grateful for that experience. I'm grateful that I stuck with it. You know, a lot of my buddies quit early on, but I couldn't quit. My mom wouldn't let me. So thanks, Mom. I wish I would have stuck with the piano too, talking about music, because she taught us piano at a young age, but only so many hours in the day. So saxophone's #1. 3 fun facts. #2, my wife and I studied abroad in Australia, and we studied in Sydney for 6 months. And our firstborn daughter is named Adelaide after Adelaide, Australia. So
Wow.
it's a beautiful name. I love the name, but also we got to go back now. We never went to Adelaide, Australia. So it was like, well, it's an excuse to go to Australia again too. So we're all going to go back to the family someday. #3, I proposed to my wife skydiving. So I think that's pretty cool. And the reason I did that was my wife figures everything out. You know, surprises, I can't have a surprise for my wife. She figures it out. So that's supposed to be a big surprise, right? Proposing. And so I had to do something crazy, and we jumped out of a plane. I went first. She went second. I was on the ground. I had a big banner. Kirsten, will you marry me? And it was videotaped. It was a good, to say the least. And she said yes. So it was fun.
That's amazing. Those are the best facts I think I've ever heard.
Awesome.
I can't touch those. That's great.
I don't know what you were looking for, but that's what I got.
No, it's awesome. I was also a fellow alto sax through jazz concert and marching band. Yes, first chair saxophone. My husband still picks on me. Yeah, I know. He was a big jock, so he's like, I can't believe I married a band geek. I'm like, hey, born and raised. That's all I did growing up is band. So let's talk.
I pulled my saxophone out a couple weeks ago.
Oh, really?
I pulled it out a couple weeks ago and played it for my daughters. Yeah,
that's amazing.
It was rough. It was rough. Yeah, but I got a couple notes out.
I don't remember anything, nor do I think I could make a sound. I mean, it's been a long time since I've held one.
It's like muscle memory, though. It'll come back to you. It's like riding a bike.
I should bring mine out and serenade my husband. He would really love that.
Put it on video and send it our way too.
Oh, that's a great idea. We'll put it on your YouTube page, Jay. They would love that. So I want to know more about, because I also work on Empire Boulevard, because I'm not from the New York area. Where are you located?
So it's 2115 Empire Boulevard. I'm inside of Innovative Dental and Wellness. So it's a big wellness center. There's physical therapy here, myself, 2 dentists, and there's a full gym downstairs called Innovative Wellness. So Jay Shiner owns the gym downstairs. I know Jay, you know Jay. Jay, you know Jay. Jay knows Jay. So it's a fun, a lot of energy here, a lot going on, a lot of healing, a lot of helping, and it's close to home too. I live in Webster. It's right across the street from Dunkin' Donuts and Empire Boulevard, big yellow building, can't miss it. And I've been here for 2 years, 2.5 years now.
Awesome. Awesome. Where would be the best place for our listeners to contact you online?
So probably the best platform is going to be Instagram. I'm pretty active on there. I try to post a daily health tip every day. It's going to be at Dr. Driscoll, so Driscoll. I'm also on Facebook at Driscoll Chiropractic. And also I got a YouTube channel too, which has a lot of the foundation training exercises right on there. So just YouTube Driscoll Chiropractic.
Awesome. Anything else you'd like to tell our listeners today?
Yeah, just getting back to low back pain, you know, it's the number 3 reason to see your doctor. It's the number 1 cause of disability worldwide. So it's an epidemic, to say the least. And I see it every day in the clinic. Probably 60 to 70% of patients that call me for so there's answers for you guys. I'm not saying it has to be. I'm not saying I fix everyone. We start with a new help. Listen, I'm not going to fix you. I'm going to help you. I'm going to empower you. Hold your body in a good place, get you out of pain, get you out of these symptoms, and then back to the activities you love. So low back pain is a real problem in our society. But again, there's answers. And those answers don't have to be surgery and injections and medications. Sometimes we need that because the pain is so bad and we just can't touch it conservatively. But I always recommend start there, start conservatively, and then I can always refer you somewhere else, or somebody else can refer you somewhere else.
Awesome. Matt, it was so great to have you on our podcast today. Jay, is there anything going on with the Webster Rec Center that you want to add in before we're done?
Actually, we're hoping to roll out a bunch of new programs. We are a couple weeks into our reopening. Having the fitness center back open, which is an awesome thing. And as I said, we got some other fall programs that'll be rolling out. You can always check our website, which we always post at the end of these. And yeah, just check out our social media, Webster Recreation, just YouTube, Webster Recreation. At the very least, we just like to hear what people are thinking, maybe what they're looking for. We're trying to really put all kinds of wellness, fitness, and even recreation-related content on there. But we'd certainly love to hear from people. We also started that wellness group off of our Webster Recreation Facebook page. So we're always looking for more people to share and engage with. So, check us out, and we'd love to work with you.
Awesome. And Wellness 360 still has our online fitness programs for people with disease management. So it's a very affordable monthly payment plan for exercise, evidence-based specific exercise for particular diseases like we have Parkinson's and osteoporosis programs and exercises for the bariatric client. Of course, we always have our mindfulness meditation because, as we've talked before, the pillars of wellness, meditation, mindfulness, and stress reduction for me is a biggie. I am going to be giving a free mindfulness talk on Facebook Live this Tuesday night at 7 o'clock to launch our first back in-house mindfulness 8-week lesson plan. So we're going to go back into the building and we're going to be back into in-person classes. It was really hard to do it from, the number one thing in mindfulness is to sit in a distraction-free area. Kind of hard when you have kids running around the house and you're on your computer and there's distractions all around. So we did have requests to get it back in person. So we'll be starting that in 2 weeks on Tuesday night. And it was so great to have you, Matt, and so nice for you to share. You've shared so many awesome tips on, especially that functional movement, and we're just really appreciative that you shared your time with us.
Thank you. Yes, that was fun.
Yeah.
All right. Take care.